Big from Sparkling White Dental Conservancy, as well as we have got Eleanor Barry from Vital Health. Today we shall be talking about a very interesting topic, which is mouth breathing in kids and in adults. So that's the formal topic we're going to talk about today.
Mr. Big, can you tell us a bit more about what mouth breathing is and is it normal?
Ellie, certainly mouth breathing is not normal, and basically it happens when the kids, they tend to breathe through their mouth more than they through their nose, and most of the time they're not even aware of the fact that they're breathing through their mouth. Now the reasons why this would happen is that there could be the anatomical reasons, like they could have enlarged tonsils, enlarged adenoids, or deviated nasal septum, or even enlarged turbinates. Because there is a blockage in the nasal passage, so the child is not able to breathe through the nose, and they tend to get into the habit of breathing through their mouth. This is what basically is the reason why the kids, they would have the mouth breathing in the first place. So Ellie, what do you observe from your speech pathology point of view, that what are the changes you see in the kids with the mouth breathing?
With mouth breathers, I tend to see a lot of people sitting with their mouth hanging open, and they often have very dry and cracked lips. This is from the airflow drying out the tissue of our lips. Also, you commonly see excessive lip licking, that behaviour over and over, trying to compensate for that dryness, and it can actually lead to nasty rashes around your lips. So lip licking and lip dry and open mouth are the things that I often see. We've already talked about how it's not normal. Can you tell me a bit about how it affects a growing child?
Certainly, Ellie. This is very interesting because of the fact that when the kids, they have got this mouth breathing habit, what happens is that their tongue does not sit against the palate. If that doesn't happen, the scaffolding for the growth does not take place. So the child would have a long face, and because of the fact that they have got a long face and their muscles, they get sucked into toward the teeth, and these kids, they would have a narrow arches, which would lead to crowding of the teeth. They would have a lot of decay or cavities in their mouth. They would have a lot of gum problems to start with, and other associated problems which always is present in the case. So and plus, because of the fact that this child would have a growth issue, so they would have issues with the general health as well. So this is what basically the mouth breathing does cause the issues. Now, Ellie, from the speech pathologist point of view, what is your observations regarding the kids with mouth breathing habit?
So as we've both said, we tend to see weakened muscles and open mouth position. Because your mouth is open, your muscles are weak, it's actually a lot of trouble for some of these people to actually lift their mouth just to make it close. This has issues on feeding and speech. If you're trying to eat something or drink something, you need your lips to seal to keep it in the mouth and not falling out. It also affects production of certain speech sounds like B for ball, or P for play, or M for more, because they require your lips to come together. We also see issues with just getting the tongue to the top of the mouth. You said we need our tongue to reach our palate. That's necessary in achieving clear speech, but also various aspects of feeding and eating. So what do you recommend for people who are presenting as mouth breathers?
Well, the first thing is that we need to find out or identify the problem is there or not in the first place. So what I would suggest is that if the parents, they do observe their kids on a daily basis, that they're moving and they're playing around the house with their mouth open, that would be the first indicator that the child may be having issues with the breathing through the nose. Now, what I would suggest is that we should get an assessment done. The first assessment could be with the dentist, that we can verify whether the child is able to breathe through the nose or not in the first place. And if there is a doubt, then we would refer you and your kid through your GP to an ENT specialist who would have a thorough assessment of the passage, so that they can find out whether there was any enlargement of the tonsils, or is there any adenoids, or deviated nasal septum, and so on and so forth. So any factor which could be causing that problem has to be identified first. And once we have done that, and then would be the stage where we will go and follow the instructions of the specialist. And once that has been taken care of, that is the way how we would address this problem. Okay. Now, Ellie, from the speech pathologist point of view, how do you look at addressing this problem if the parents come to you with a child who is a mouth breather? Do you help the child with certain exercises or retrain to reposition their tongues and the lips?
Very good question. So much the same as you would start, its airway is the priority for me. I want to make sure that child's able to breathe through their nose, because if it's blocked because of structural anomalies, there's no way we're going to be able to correct that mouth breathing habit. So yes, referrals to ENTs, to dentists, anyone else who's involved in that area of the anatomy is really important. And then from my perspective, I do perform exercises. I try and get that tongue lifted up. I try and strengthen the muscles around their mouth so that they can achieve closure and of their lips, to then hopefully help with their everyday function in speech and feeding.
That was nice. Nice to know from your perspective as well.
I guess the big thing is just parents, if you're concerned, even if you're not sure, just ask. The worst thing that can happen is we say, nope, it's not a problem, they're temporarily congested.
Yes. Now it was a nice discussion today on this a very important topic, and if you would like to have more info on that, you can get in touch with Ali Berry at the Vital Health in Gundawindi, and if you want to have a discussion with me, you can come to our surgery at Spartan White Dental, 153 Marshall Street, Gundawindi, and we shall be putting in a few more good topics in the future as well, so keep on lookout for them. They'll be very, very informative, and we are working as a team so that we can help the community of Gundawindi and surrounds for their health and well-being. Thank you.